Hello everyone. In this video, I'm going to talk about empagliflozin. Empagliflozin is a medication classified as an SGLT2 inhibitor. It is a sodium glucose transporter 2 inhibitor. Empagliflozin is well known under the brand Jardiance. This medication not only reduces the glucose levels, but it can also reduce the risk of heart failure. It reduces the need for hospitalization in the people with heart failure. It can also be used to reduce the chronic kidney disease, where it can prevent a sustained decrease in the glomerular filtration rate. It can also be used for end-stage kidney disease and cardiovascular death. In this video, we are going to discuss essential things that are required to know before the use of empagliflozin, like how this medication works, how to take this medication, and what the important precautions and side effects are. Now let's see how this medication works. Empagliflozin is a medication that belongs to the class of sodium glucose transporter 2 inhibitors, SGLT2 inhibitors. This SGLT2 transporter is expressed on the proximal renal tubules. It is responsible for the absorption of filtered glucose, and most of the filtered glucose is absorbed through the SGLT2 transporters from the tubular lumen into the systemic circulation. Empagliflozin is a selective inhibitor of this transporter. Thereby, it inhibits the glucose reabsorption, and it reduces the renal threshold for glucose. This results in the increased urinary glucose excretion. Along with glucose, this medication can also reduce the sodium reabsorption. Therefore, the sodium in the filtrate is more reaching to the distal tubule. This may cause a few physiological changes. Particularly, it can reduce the preload and afterload of the heart, and it also reduces the sympathetic activity. All these actions may reduce the risk of heart failure and reduce the need for hospitalization. Now let us see how to take this medication. Empagliflozin is available as tablets at 2 strengths, such as 10 mg and 25 mg. For the treatment of type 2 diabetes mellitus, empagliflozin can be used at 10 mg per day. Based on the need and tolerability, the dose may also be increased to 25 mg. To reduce the risk of heart failure and reduce the hospitalization, it can be again started at 10 mg per day. This medication can be taken either with food or without food, but you should take adequate fluids to reduce the risk of hypotension. This medication is not recommended in people with ketoacidosis or in people with an estimated glomerular filtration rate of less than 30 milliliters per minute. Side effects. This medication can produce urinary tract infections. It can also produce female genital mycotic infections or fungal infections and upper respiratory tract infections. It may result in increased urination, joint pain, and nausea. You may also have decreased blood pressure, orthostatic hypotension, and syncope. Now let's see the precautions to be considered. Empagliflozin can produce a condition called ketoacidosis. This is the elevated level of ketone acids that may be associated with diabetes. It involves few symptoms like thirst, frequent urination, fruity-smelling breath, and rapid breathing. It can also produce some muscle weakness, stiffness, and muscle pains. If you observe such symptoms, it may indicate the development of ketoacidosis. This condition can be further increased in people with few risk factors, like prolonged fasting, diet restriction, or insulin deficiency. Therefore, before starting the therapy, assess the keto acid levels, and if you observe any significant ketoacidosis, immediately discontinue this medication. Before the surgery, for at least 3 days, this medication should be discontinued because it may increase the risk of ketoacidosis after the surgery. If you have any pancreatic disorders, the risk of ketoacidosis may be elevated. Similarly, in the people with type 2 diabetes mellitus, elevated levels of glucose can also increase the ketoacidosis. However, in a few people, this condition can also be observed with normal levels of glucose. If you're taking a lower dose of insulin, or you have missed an insulin dose, or in the volume depletion by use of any diuretics, the ketoacidosis may be elevated. After discontinuation of the therapy, ketoacidosis may be slowly reduced within 3 days, and glucose in the urine is excreted for 3 days after the discontinuation. However, in a few people, this excretion of glucose in the urine may be observed after 6 days of discontinuation. Empagliflozin can cause another condition called volume depletion. This results in a decrease in your blood pressure and few changes in creatinine levels. It can also develop the acute kidney injury, which is more pronounced in elders or people with impaired renal function. If you're using loop diuretics like furosemide, they can produce significant volume depletion and hypotension, which is further increased by empagliflozin. Therefore, before starting the therapy with empagliflozin, check the status of body volume and renal functionality. If you have any symptoms of volume depletion, which is observed as significant hypotension, you shouldn't use the empagliflozin immediately. It should be started after volume correction only. Acute kidney injury can also be increased with other risk factors, like the existence of heart failure or chronic renal insufficiency. If you're using any other medications like diuretics, ACE inhibitors, NSAIDs, or angiotensin receptor blockers, they can increase the damage to the liver, leading to acute kidney injury. Therefore, along with these medications, empagliflozin should be carefully used. This medication can increase a few fungal infections. Particularly, they can increase the genital fungal infections. These are mild, and they can be observed in both the men and the women. They produce some itching, burning, and even vaginal discharge. If you observe any such symptoms, empagliflozin should be carefully used. If you observe these symptoms, they may be treated with an antifungal ointment to control fungal infections. Empagliflozin can increase the risk of bone fractures, so if you have any previous history of weak bones or bone fractures, you should use this medication carefully. This medication can increase your serum creatinine levels, and it can reduce the glomerular filtration rate. Serious hypersensitivity reactions can be observed with this medication. It may produce angioedema leading to swelling of the tongue, face, and larynx. This medication can increase the urinary tract infections. In a few people, they may produce few of the serious infections like urosepsis and pyelonephritis. These two conditions are life-threatening, and they may produce frequent urination, painful urination, and even result in blood in the urine. Whenever these symptoms are discovered, immediately empagliflozin should be discontinued. These are the essential things that you should know about empagliflozin. That's all, guys. Thanks for watching this video, and if you find any interesting facts on this medication, please share them in the comment box below. Please do subscribe and hit the like button. I will come with another interesting video in the next week. Until then, have a nice time, take care, and goodbye.